I'm Lionel Lenkinski, CEO of Volume Vision. What follows is a presentation of images showing both our proposed software platform for degenerative disc disease and CARDISTEM, and some other utilities and platforms that we've developed independently. We were introduced to Xemina through Siemens Healthineers, as we have developed technology that can take standard two-dimensional MRI images, turn them into three-dimensional displays to show specific anatomy that can't be seen from simple MRI scans. This is called segmentation and volume rendering. This will help Xemina in its clinical trials and support the changes that will happen through the effective use of CARDISTEM, provide confidence to the patients and clinicians, and also give numeric values to the independent investigator trial that will prepare it for publication in a major medical journal. Our software platform operates very simply. Standard MRI images are imported into the software in DICOM format. The software then displays these input images as a 3D reconstructed anatomic view. And with very limited user interaction, the tissue of interest is displayed as a segmented object, meaning the disc, for example, will be shown in isolation and then ultimately in the context of the surrounding anatomy. The software has tools to provide measuring tools and then time point comparisons, and will also provide output of JPEG and picture images for the user and the patient to take home and look at their condition. The objective is to provide a software platform that can measure data for the clinical trial, both preoperatively and postoperatively. Also to assure that the quality of the input images are adequate to get this data, show the progress of the treatment, and then gather data so that we can perform a study that has validation and has enough objective data to be accepted in a major medical journal for publication, which will perform two functions. It'll provide more confidence for the clinicians and also drive widespread use of the product. This is a view of the graphic user interface for our spinal surgery platform to show you an example. What we see on the left here in these four boxes is the MRI inputs. On top, the CT input, and here in the bottom right, the 3D window showing the reconstructed spine in 3 dimensions with these white lines representing the spinal nerves as they exit the vertebral foramina. This is a close-up view of what you saw on the bottom left, showing the spinal nerves with some of the bony anatomy made more transparent so you can see the entire course of the nerve as it runs from inside the spinal cord to outside the spinal column. Again, a close-up view just so you can get a better appreciation for what a 3D reconstruction software from standard MRI and CT images can produce with the segmented nerve volumes shown here in white, so that you can see them in isolation without the surrounding anatomy obscuring the view. So here you just see the bones and the nerves without all the soft tissues superimposed, so the clinician can get a better view. Again, this is just the view without the bony anatomy over top and just the nerve shown as a 3D volume. And what we see here is the comparison of the input images to the outputs, which gives you an idea of what can be done from standard imaging using a software that does 3D volume rendering and segmentation. What we are showing here is the segmented nerves and tendons in carpal tunnel syndrome as an example of what segmentation software can do. The nerves and tendons are shown in color, and the wrist MRI reconstruction in 3D is shown in beige. What we are showing here is a video of what's called clipping, which is when you remove the anatomy overlying the segmented structures to expose it so that the clinician can rotate it and look at all sides to examine for pathology. This is definitely something that can't be done from standard 2D MRI imaging and is one of the added functions of having a 3D volume rendered reconstructed platform. Here we show an example of a
MRI series that was reconstructed in our software with the shoulder, arm, and chest, looking for ulnar nerve pathology. Here's the 3D reconstructed nerve in the middle, and you can see that there's a small sphere in the middle of the nerve. That's the schwannomatosis, which is the pathology, and here it is with the anatomy taken away over top so that it can just be looked at in isolation. So let's take a look at what we're planning to do for the disc. Here you can see the outline of the disc in black, showing the volume of the disc, and this will be turned into a 3D object with the segmented disc being able to be seen inside the context of the MRI anatomy or in isolation. What we're looking at now is possible measurements of the angle between the vertebrae, and shown here is the two black lines, and being able to measure the height as well, so we can give the clinician some measurements to assess the situation before therapy is undertaken, and then measure comparative data as this goes along. We created this video going through the slices that were taken in a standard MRI series, showing the disc volumes here with 2D representations. Ultimately, this will be converted by the software once it's fully developed into a three-dimensional rendering to see the disc as the object segmented, again, both in the context of the anatomy or shown in isolation. So to summarize, what we will provide is an easy-to-use tool which will be fully automated, which will provide data both preoperatively and post-treatment for the clinical trial and for publication, and give a quality assurance measure to show that the images being input are sufficient to do this and have reliable results. We're experienced in doing this. We've previously filed an FDA clearance which has been approved, which we will do again in this project. And we will also provide a validation study which will prove that the data that you're seeing in the reconstructed images mathematically matches what would be happening if this was traced manually by clinicians. And this will further give comfort that the results will be useful and will be accepted for publication. Thank you for watching this presentation. We look forward to working together and providing you the tools to help support the study and the widespread use of Cardazen in your clinical trial and ultimately into clinical practice in your hospital facilities.